global pandemic we can never take for granted. Kila must be alert. It's a matter of life we can never take for granted. Discipline and personal hygiene, and make sure you regularly wash your hands. Keep a distance from everyone. Report anything like a symptom. Serious fever is a symptom. Dry cough is a symptom. Walkway tamala is a symptom. Itchy eyes and flu is a symptom. Wikumo butabusiga bejemu batanalwala ulago moyo gwe gwanga labira kuyitale abasinga bafudde okubwebala kisingako bujjanjaba. The coronavirus is sweeping over mankind. Everybody must be alert. It's a global pandemic we can never take for granted. Kila mtu must be alert. It's a matter of life we can never take for granted. The coronavirus is sweeping over mankind. Everybody must be alert.
Hi, everyone. Thank you for joining us today. We're excited to get started. So I'm just going to do a couple housekeeping details before we go into the actual panel. So my name's Tara Spickerhoff. I'm a communications officer with Farm Radio International. And I just want to go over a couple of things before we begin. So right now we're presenting a slide here, but when that finishes, what we'll ask you to do is make sure that you're in speaker mode when you're viewing the presentation. So that'll be in the top right corner where it says view options. There's an option for gallery view, which has a bunch of squares, and an option for speaker mode, and we'll ask you to go into speaker mode. And then the chat is open to everyone, so we'll be taking questions throughout the session. We'll be having a Q&A portion at the end of the chat, so feel free to ask your questions as we go along, and we'll do our best to get to all of them, and perhaps follow up with any other questions that we aren't able to get to during this session. We're also recording this, so we'll be able to share it after the fact, so if you miss anything or have to drop out, we'll be recording all of it. And like I said, there will be 10 to 15 minutes at the end to ask questions, so feel free to submit them through the chat, and you can access the chat by going to the bottom of your screen where it says chat. Now we'll begin, and I'd like to introduce our Executive Director for Farm Radio International, and that's Kevin Perkins. So Kevin, it's your turn.
Thank you, Tara. Welcome, everybody. I'm delighted to see so many of our Canadian supporters here with us for this first ever, and probably not last, Farm Radio Town Hall on Zoom.
Hey,
Farm Radio International is all about connecting people with life-changing information from a physical distance over the airwaves. But this is the first time we've used communication technology to bring our Canadian supporters together with the people we work with in radio stations across the continent of Africa. Many of you have been part of our work for years and don't need an extensive introduction, but for those who are newer to our work, or as a refresher, let me start with a brief overview.
Kevin, actually, could you turn your video on before you begin?
Whoops, sorry. Should I start from the beginning? Okay.
Go ahead.
All right, thanks. So many of you have been part of our work for years and don't need an extensive introduction. But for those who are newer to our work, let me start with a brief overview. We are a 41-year-old charity, Canadian charity, that brings amazing change to the lives of millions of rural African citizens. We do this by helping over 1,000 radio stations in Africa offer their listeners powerful radio programs that meet their information needs, amplify their voices, and support them in bringing positive changes to their farms, their health, and their households. Radio remains the best way to reach nearly everyone, and good radio programs can result in real measurable change for farming families. We found new ways to blend radio with the other most powerful communication tool in rural Africa, mobile phones. Radio plus mobile phones make a beautiful partnership because phones allow radio programs to be more interactive, and radio content can be accessed on demand by making a cheap phone call. We work directly in 9 African countries where skilled national staff work in close partnership with over 120 radio stations to produce carefully designed series of high-impact interactive radio programs. These programs serve over 30 million people every week and help the listeners make important changes in their lives and in their communities. COVID-19 has affected everyone on the planet. In Africa, like everywhere, it has caused illness and worries about illness, confusion about causes and prevention measures, and huge economic hardship. There are growing concerns about food security, unemployment, bankrupt treasuries, overcrowded hospitals, illness, and suffering. Over the last weeks, we in Canada have heard much about the heroes and heroines on the front lines in the pandemic here. We honor and thank health professionals, caregivers, first responders, even grocery store workers and others who are taking extraordinary risks to try to keep us safe. Well, the same can be said about broadcasters. In Africa, radio is their primary or perhaps the only source of information for rural people about COVID-19. It is where people turn to get the facts, learn about prevention measures, learn about what they should do if they or their family members show symptoms. It is essential that broadcasters get the facts right, and that is not easy to do. In fact, radio broadcasters can inadvertently spread false information, rumors or conspiracy theories, supposed treatments or cures, assignment of blame. They need to be able to separate fact from fiction and debunk myths when they surface. They need to help their listeners stay calm and avoid panic. Most importantly, they must stay on the air. That's not easy to do when COVID-19 lockdowns make travel and assembly difficult, and when shortage of fuel can turn off the generators they need to run their transmitters. They need to do their work safely and keep their own health in mind. We have taken strong steps to support our African broadcasting partners as they work hard to provide their listeners with good information. With support from you, our donors, and also from Global Affairs Canada, we've initiated 4 important activities to achieve this. First, we're producing and sharing resources that broadcasters across Africa can use to produce good, accurate programs. Things like background documents, how-to guides, scripts, news stories. Second, we have started connecting broadcasters with each other through local networking activities. Third, we've created a new hotline service called the Broadcaster COVID-19 Interactive Response System. Finally, we've created an emergency support fund to help broadcasters stay on the air. We'll offer micro grants to radio partners to help them meet their short-term needs. For example, fuel to keep their generators humming, credit for their phones, and data for internet use so they can get the latest information, equipment repairs, sanitizers, face masks, and other protective supplies. We're launching the fund tomorrow. While it's modest now, we hope to grow the fund through donations so that we can keep as many broadcasters on the air as possible. My colleague Carolyn will be going into more details about these activities, but let me take this moment to announce that Global Affairs Canada has agreed to support these initiatives with an extra contribution to the Farm Radio International program they've been funding for 2 years. So many thanks to Global Affairs Canada for showing support for this work. Now, you've heard enough from me. We're here today to hear mostly from African broadcasters and from other colleagues who are on the front lines in this work. So let me turn it over to the host of this discussion, Nora Young. Now, you will know Nora Young as the host and creator of Spark, CBC's national radio show and podcast about technology and culture. She was a founding host of the CBC radio show, Definitely Not the Opera, where she often focused on new media and technology. Nora has also recently joined Farm Radio's board of directors. As a journalist, author, and speaker, Nora explores how new technology shapes the way we understand ourselves and the world around us. She's a particular interest in how new digital technologies can flatten hierarchies, spread ideas, and foster more sustainable environments. Her book, The Virtual Self, on the explosion of data about our behaviors, opinions, and actions is published by McClelland and Stewart. She's an avid hobby podcaster and a radio fan, though her favorite technology is her bicycle. Nora, over to you.
Thanks so much, Kevin. It's a pleasure to be here. It's a pleasure to be on the board of directors. I'm very excited about that. And I have to say, as a broadcaster, I'm very excited about this afternoon and talking to my esteemed colleagues about what they're doing, what they're experiencing, and how they're bringing their expertise to bear. So just to give you a quick idea of the order of the event, joining us today are Jefferson Massa. Jefferson is a broadcaster, media trainer, and development communications practitioner. He's based in Monrovia, Liberia. Then we'll hear from Emmanuel Asamoah. Emmanuel is the program manager at Radio 1 in the eastern region of Ghana. There, he's currently running programs about COVID-19 and using farm radio resources to do that. We'll hear from Caroline Montpetit. Caroline is Farm Radio's regional program manager for West Africa and their gender equality advisor, and she's based in Ottawa. Caroline heads Farm Radio's program work in West Africa, and she brings a strong gender lens to their programming. And then finally, we'll hear from Pascal Mweruka. Pascal is the Radiocraft team leader for Anglophone Africa with Farm Radio. Pascal co-heads the team that trains radio stations and ensures radio quality in our projects. Pascal is based in Uganda, although today he is joining us from Nigeria. And just a reminder from Tara off the top, we'll have a Q&A at the end, so please do think about submitting your questions through the chat. So let's get started, shall we? I'd like to get right into talking to Jefferson. Jefferson Massa is a broadcaster, media trainer, and development communications practitioner based in Monrovia, Liberia. There, he's currently working with a network of 30 radio stations on a project to respond to COVID-19. He has extensive experience broadcasting in pandemics due to his award-winning coverage during the Ebola crisis. Jefferson won the prestigious George Atkins Communications Award from Farm Radio International for that work. Hi, Jefferson.
Thank you. How are you?
So, I'm very well, thanks. Thanks so much for joining us. So first of all, can you describe the work that you and other broadcasters you work with are doing right now as part of the response to COVID?
Thank you very much. Again, I'm Jefferson, and it's good to be part of this global platform to share with other colleagues and other within the media sector and those that support the work of the media across Africa. That we will be able to share common experiences when it comes to epidemic in Africa, how is it been, and then the role of radio. So as you asked, yes, I currently work for the Liberia Media Development Program, an initiative that is designed to support media sustainability, that is also intended to enhance media professionalism. So as part of our project on support to ensuring that rural communities have access to information to keep safe, that is life-saving information in the midst of the COVID-19 outbreak. We are currently partnering with 30 rural radio stations across the country to ensure that we provide updates in terms of information pertaining to the disease, how rural communities can prevent themselves from the further upsurge of the disease, how they can get the needed health tips to keep safe, and then continue with their farming activities and other livelihood activities. Because radio, especially in Africa, Liberia not being of an exclusion, it still remains a major source of information dissemination. So that's part of what we consider as an upsurge in internet. You still have radio to be the less saving medium of communication for thousands, or not thousands, but millions of Africans across Africa. So because it is cost effective, it is accessible, it is affordable. So a lot of people turn to use radio to access information. So the case here, Liberia currently has a little over 140 confirmed COVID-19 cases, and efforts have been made to ensure that we prevent the further spread of the diseases is more left still around the urban centers. So how do we engage rural communities? How do we engage the greater population to keep safe? So we use radio talk show, jingles, drama, and other radio formats to ensure that we get to people across the 15 counties of Liberia and to keep them informed about happenings at the national level, at the same time utilizing local experts at their level to increase awareness about COVID-19. And these radio programs are done through radio stations that have been trained under our project, journalists that have the skill to organize a better talk show. And then also, we also have cream of journalists that have been trained to report what we call reporting responsibly on COVID-19 or responsibly reporting on health-related issue. So these are the ways that we are working with the radio, especially the radio sector, to ensure that we have the population informed about COVID-19 and how to employ those preventive measures in keeping themselves safe.
Mm-hmm. As I mentioned, Jefferson, you did quite a bit of work during the Ebola crisis in Liberia. What did you learn from broadcasting during that crisis that might apply now?
I think the Ebola was our first experience in terms of reporting on public health or major epidemic, especially in West Africa, where this was a regional outbreak in the Mano River Union Basin, Liberia, Guinea, and Sierra Leone. The three countries were hard hit by the Ebola outbreak. And then being a radio producer then, and then engaged with active radio programming through support from farm radio, we're able to produce high quality radio programs. In showing, the first thing was that how do we tackle the issue of misconception about the disease, because this was the first situation. People thought Ebola was a man-made disease, imported, and then it was intended to get rid of maybe a certain population. So people thought that going at the hospital, in fact, was like a death sentence. So how do we disabuse the minds of people to ensure that getting early treatment, getting to the nearest health facility will create the chances of you surviving, then isolating yourself and keeping maybe somewhere and not reporting your case to a professional health practitioner to tackle or maybe to find a solution to your health problem. So, and then there was this issue about the ETU, the Ebola treatment unit. So people thought going at the ETU was like, now you are going to be sentenced to death. So how do we motivate people to ensure that they get at the Ebola treatment center, that the earlier you visit, if you have been diagnosed of the symptom of Ebola and other maybe illnesses, not very comfortable within yourself, the earlier you get at the health facility or the Ebola treatment center, your chances of survival will be high. So that was how we were able to ensure that a lot of people got motivated to visit health facility. And then we did not just stop there, but then also see how we talk to survivors. So they bring the success story. So on several occasions, we talked to people that survived Ebola. And then when people heard their story, then they develop the hope and courage that yes, if maybe I'm not lucky, or maybe if I'm unfortunate to come across maybe contracting Ebola, my chances of survival is also there, because hearing from the story of Mr. X or Y, I think the better I go to the health facility or the sooner I visit a health facility, my chances of survival will be high. So that helped to, the first thing, build confidence among people, build trust and relationship between health service providers and patients. And then people were able to realize that Ebola was not man-made virus, but a disease that if they develop the courage and motivation to seek early treatment, their survival is high. So that's how we're able to tackle the virus outbreak. And then we also, because we're like dealing with raw people. So, and the Ebola came during the peak of the farming season, and that greatly affected farmers. So how do we help encourage farmers to adopt other practices while grappling with the Ebola impasse? So we also focus a lot of attention on smallholder farmers, ensuring that they have access to farming information that will ensure that they continue to farm, but then remain very careful as to how they go about, because if not taking the preventive measures or maybe those steps required while you farm to eat, maybe the next day you fall ill. So how do we strike the balance, continue to farm, but then keeping safe and then protecting yourself against Ebola? So these are some of the way we tell our activities in 2015 when we highlighted issue pertaining to Ebola. For now, I think with the experience from Ebola, and then the skill acquired, because Ebola was our first experience. So, I mean, in the early stage of communicating, there were problems in terms of how to send out the message. The messaging had problem even at the level of the health service providers. So it took some time for people to do proper messaging. For example, messages came out, if you get Ebola, you will die. And then there were no hope created at that time. But the message had to change. If you have Ebola and the sooner you visit a health facility, your chances of survival will be high. So that was able to create a room of opportunity for people to know that it's not just a death sentence, but taking early treatment, you will be on the safe side of the virus. So, but for now, I think as a result of the Ebola experience, there are a lot of good grasp and understanding how to communicate public health issue as compared to 2015 when we had this onslaught from the Ebola. And then at that time, our health system was not that responsive as now. So as a result of the Ebola for now, like in Liberia, you now have what we call the National Public Health Institute, which was established as a result of the Ebola outbreak, lesson learned from the pandemic outbreak. So as a result, now you have a much stronger and much proactive response mechanism and much coordinated information dissemination as compared to the outbreak in 2015. Though Ebola and COVID-19, they are not of the same in terms of the mode of transmission, but then they are linkages, so how drawing from the Ebola experience and understanding what COVID-19 is much easier now to communicate, to get across as compared to what we experienced in 2015.
Yeah. Jefferson, it's fascinating. Thank you so much for sharing your insights on that. And I'm sure people will have questions for you at the end. Thanks.
Yeah, I'll be available for that.
Great. I'd like to turn now to Emmanuel Asamoah. He's the programs manager at Radio 1 in the eastern region of Ghana. And there, he and his team are currently running programs about COVID-19 with the help of Farm Radio Resources. Emmanuel has over 15 years of experience as a broadcaster. He's a longtime broadcasting partner of Farm Radio International. With a background in civil engineering and environmental science, Emmanuel has always learned on the job. Hi, Emmanuel.
Hi.
Hi, can you hear me okay? Hi. Hi. So tell me a little bit about how your station is responding to COVID-19.
I don't know whether you can also.
Yes, we're
a little bit of a delay there. I'll ask that again. How is your station responding to COVID-19?
I've been listening to Jeff. It's very interesting what he talks about, because he seems to have, or Liberia seems to have an experience because of Ebola. Ghana, we never experienced Ebola at the time, so this is the first time we're going through something of this nature. So we're actually putting ourselves together to see how best we're able to cover this whole thing. It's not been easy. But I'm sure we'll tell you much more as we go on with the interview.
So tell me a little bit about that. What challenges are you facing in doing your programming right now?
So, first of all, I think I need to thank Ben Fiafo, who happens to be director of Farm Radio Ghana. Just when we had our first case, second case, then we recorded the first death, Ben put up some guidelines as to how we could broadcast or educate our listeners on what's happening. So in fact, my radio station used to have a health program on Wednesdays. So what we first decided to do was to focus on Ebola on every Wednesday between 1 and 2 p.m. Then I needed to institute an Ebola alert every day from Monday to Friday at 10. So I engaged Ben. He gave me some educative audio materials. Yes, on COVID. I mean, so these are audio tapes in different languages. So in Ghana, we speak a lot of different languages. So there was one on Chi English, Hausa, and other languages, which I aired to educate my audience. Then on issues of challenges, I mean, first of all, it was the first time, like I mentioned, Ebola had never visited Ghana, so most reporters have not seen such things. So people or reporters were actually not comfortable even reporting to work, not to mention sending them to places to go and cover events. People don't want to sit in vehicles because we're actually uncertain as to mode of transmission. And even as we speak, I can't tell whether it is airborne or it is just about the cough or, whatever comes out of a cough or a sneeze. So people are still, let me use this word, we're in a dilemma as to the mode of transmission. So workers or reporters don't want to come. Reporters are feared to go out to pick up news. Then there was a lockdown in the two major cities in Ghana, that is the capital Accra and that of Kumasi. So what happened was that there was no movement. But let me put this. My region is actually between the capital of Ghana, Accra, and Kumasi. So if you're moving from Accra to the second largest city, Kumasi, you have to pass through my region. So when Accra was locked down, Kumasi was locked down. It means economic activities was very problematic in here. Advertisers have actually put on hold their adverts, so you don't have adverts running to make money to be able to continue with your job. Electricity was actually unstable. You need to find fuel to run your generators to be able to operate. Internet's very expensive and sometimes not reliable. So then there is a challenge. Again, we have to limit inflow of studio guests to the most important one and then focus on doing for what we call phone interviews instead of allowing people to come to the studio because you don't know who is coming and what the person is coming. We also have to raise resources to get protective equipment or gears for the workers, nose masks, need to provide hand sanitizers to most essential areas in the office. We need to find Veronica buckets, soap, that is liquid soap, and that of tissue paper to ensure whoever walks to the facility wash their hands very well, including the workers before they enter. At the studio, we needed to find some sanitizers to be able to disinfect the studio and the studio equipment because we're sharing what we call microphones, we're sharing keyboards, we're sharing mouse. So periodically we need to do this. We all need to disinfect or clean door locks and all that. So we need to find a lot of money to be able to do all these things. But the most of it has to do with nose masks, which is difficult to find. And then also prices has gone up. So unfortunately, it's just recent that we are doing locally manufactured nose masks made of cloth, which we're trying to use in the country. Even that is an issue. So radio, this is what it is. The challenges we've gone to be able to give this report. Like I said, Jeff seems to have an experience from Ebola. We don't. There's a first epidemic that is of a higher magnitude. Let me help put these figures. As I speak today, Ghana has actually, the cases we have now is 2,074 as of today. Recovering, or people who have recovered happens to be 212, and we have recorded 17 deaths. In the region where I find myself, we've recorded 70 cases. This actually puts fear and panic in people as we speak, because we don't know what is next. Even though the lockdown, there was a partial lockdown, the ban has been lifted, people going normal, which some people think it was an unpopular decision, but that is for politicians to deal with.
Mm-hmm. Do you have a sense of what sort of myths or misconceptions are out there, and how are you dealing with them?
Nora, can you hear me?
I can hear you. Can you hear me? I don't think you can hear me.
Emmanuel, are you able to hear me?
Yes. I cannot hear your question on.
Tara, maybe you can pass a question on.
What do we call? Okay. So, like I mentioned, on issues with myths, first of all, Ghana never believed COVID-19 was going to get here because of how our borders were actually managed during Ebola. Then all of a sudden, we started recording cases. So, and again, people began having this myth that the temperature in Africa and in Ghana is so high that a COVID won't survive, or yes, coronavirus won't survive in Africa. Then we started recording cases. Then people started having the belief that hand sanitizers have alcohol in it. So what it means is that our locally manufactured alcohol, popularly known as akpeteshie, which is, the percentage of alcohol is very high. Sometimes you can get as close as 90. They felt when you drink it, it can actually kill the virus. So people would have to stick to drinking of alcohol and thinking that it would prevent them or boost their immunity against the coronavirus. Then there are people who believe that some of the spices in Ghana can actually deal with COVID-19. So they would want to mix alcohol with what do we call garlic and then lime and see what would happen. So people had these beliefs. Again, that is working, or it actually worked. I think people have grown to accept the fact that it is not really just like that, because if you see the figures that are actually going up, the possibility of any locally manufactured concoction will deal with it is an issue. So we need to speed up and do more publicity and sensitization on these myths and let them know the challenges if they should stay with the myth. But there are issues of availability of these tapes, and then again issues of costs if we can pay for it to be run.
Yeah.
Then we get into issues of mode of transmission. People need to begin to understand it properly because people don't get it. So even wearing of nose masks, in the last presentation of our president, we're trying to make it official for whoever wants to step out of a house. Make sure you are in a nose mask. We don't know whether government will want to get some legislation to enforce that, because there are people who still don't believe in the nose masks. I think I spoke with somebody yesterday who was like, if these things can prevent coronavirus, hand sanitizer, nose masks, then the developed countries would have fixed the problem, because they could have produced, or they may have, or they had a lot of nose masks and that of hand sanitizers, and they could have dealt with the situation. So these are some of the things playing out, and we need to speed up with education so that we don't get, because if you check, our cases are actually rising by the day. It started from 2, and here we are with 2,074 cases. It started with 1 death. Now we have 17 deaths as we speak. within some few, I think a month plus. So these are issues. Then it comes to the issues of stigma. When you cough, now you're in trouble. If you sneeze in public, now you're in trouble. People begin to run away from you. When you have fever, you're in trouble. Let's not forget, in fever, in Africa, in Ghana, it is a common thing with malaria. Malaria is common disease with Africans. So, I mean, and if you check the symptoms of malaria, fever is one of them. So mostly, when you cough, you sneeze. Yes, we're perceived naturally to have been one of the normal cough thing. Then when you have fever, we thought it's supposed to have been malaria. Now there is a problem. Even hospitals are stigmatizing with people who come to the facility with cough, sneeze, and then when you have a little bit of a fever. We're trying to sensitize people on all these things, but the issue is availability of resources.
Right. And so just finally and briefly, can you speak a bit about how you're using farm radio resources to support your work?
So first of all, I think I mentioned a document outlining how we should do, because I mean, media can be very sensational about reportage at some, times of this nature, which actually could have heightened panic and within the system. So they issued to members some guidelines on how we should actually broadcast COVID-19 activities or cases, and not to put fear and panic in people, which we've actually gone through. As a programs manager, I've had a lot of discussion with my presenters on how to more of education, spreading the news of it is real, let's stay home, let's do this, rather than, people are dying, rushing to give updates of people who are actually getting infected and all that. So we'll follow that. And then again, they shared some educative audio materials that we could air direct to sensitize people, which I think has been very, very useful, because even the government itself has not produced such materials. So it's either the radio station yourself produce it, or if you have any other source or means, you do, which of course I think Ben and his team in Ghana has done a great job to that effect. But we're still communicating. So whichever new things are coming, we will look at it and then make use of it in our facility.
Yeah. Emmanuel, thanks so much for telling us about it. It's very interesting. And of course, again, if people have questions for you, they can submit them at the end. Thanks so much.
Yes, I'll stay tuned for if there is any question.
Yeah. I'd like to move on to Caroline Monti. She's the Regional Program Manager and Gender Specialist for Farm Radio International. She oversees programming across West Africa and helps to integrate gender equality principles into Farm Radio's work. Carolyn has a strong background in community development and gender equality, and she's currently leading the team adjusting Farm Radio's programming to COVID-19. Hi, Carolyn.
Hi.
So what are the new programs that FRI is starting to develop and considering to respond to COVID-19? Kevin mentioned it briefly off the top. Maybe you can flesh it out a little bit.
Exactly. So what we've been designing here is a radio response to be able to support rural communities in sub-Saharan Africa in being more resilient in the face of COVID-19 and the impact on the social, cultural context in which they live in. And so our response is is deeply rooted in our partners and our radio stations that we work with on a daily basis. And the idea is really to be able to support them in doing the work that they always do and give them access to the necessary resources. And so Kevin mentioned those 4 components of the response that we've been working on. The first one is being able to develop new resources and share them very broadly with our network of radio stations that address issues on how to stay safe while providing information on air, how to provide the right information on COVID-19, but also information on the impact of this crisis on women and men. These information are evidence-based and they are written in a language that is easy to translate in local languages as well. So some example is recently we've been able to share some information about, for example, the impact of the COVID-19 ban on livestock markets in Uganda, or in Burkina Faso, how to do safe hand washing while not having access to running water. And we've also been able to share a guide on how to do effective programming in times of emergency. Another key component is being able to link the broadcasters together. I think we've heard from Jefferson and from Emmanuel, they have great expertise, and what we want is being able to facilitate that discussion among them and create a space online for them to learn from each other basically and support each other. So we've been using networks like Facebook and WhatsApp to just give them a chance to be working and discussing together. We're also working with a team of local networkers that represents, a good gender balance, and they all speak a variety of local languages so that they can constantly be in communication with the radio stations and with our office to make sure that we can help them as much as possible and have access to the right information. Another key component is this hotline service for broadcasters. And so this is a digital tool that we have put in place. We've developed it and we're now starting the delivery process. But we're giving access to broadcasters to this hotline where they can call in and access information to respond to the question that comes up from their listeners. And so they can select options and get information on how to stay safe and, information on the facts behind those myths that we just heard about. They also have a space where they can record their own question, and then public health experts and gender equality experts will be able to answer those questions and get them the information that they need to share this back. Mm-hmm. And then the latest, the last component is this emergency fund that Kevin also mentioned. And so we've heard on some of the challenges that our partners are facing, and we want to be able to give them access to financial resources to make sure that they can stay on air.
Yeah, can you expand on that a little bit? How will Farm Radio's new emergency fund be used?
So it can be used, we will launch the fund very soon, and broadcasters will be able to apply. And so during this application process, they will be explaining to us the challenge that they're facing and what is it exactly that they need. It could be used for funding for fuel for generators, for supplies to stay safe, like the masks or material to wash your hands. It can be used for phone credits and internet connection fees, and basically all of those things that they really need to make sure that they can stay on air. We have heard, so many stories of broadcasters that, have to go a very long way to be able to keep information available to their communities, and we want to be there for them as much as possible.
Mm-hmm. And so what are some concerns about gender right now as it relates to COVID, and how is Farm Radio addressing some of that?
Yes, what we know right now is that the sex disaggregated data that we are getting doesn't show that there's a difference in the cases between men and women, but what it shows is that there is a difference in how vulnerable to the disease women are particularly, and how the mortality rate may also differentiate from being a woman or a man. And so these are the kind of things that we really need to be taking into account. For example, what we've noticed is that women are more at risk of being infected simply because of how what we call gender division of labor, which means the tasks that are assigned to men or women in communities and around, in the household. What we see is oftentimes women are the one taking care of the sick and of the elders, which means that they are more exposed to the virus. They also make up for the vast majority of the health workforce, which means that they are very much at the front line helping those affected by the virus. At the same time, when we see schools being closed or childcare services being closed, it means that the burden on women is therefore increasing. Mm-hmm. We also see that there is increased risk of gender-based violence in terms of crisis. We've seen it during the Ebola crisis, and we are starting to see it now with information coming on this COVID-19 situation, where women that are, for example, in quarantine may face higher risk of domestic violence, and at the same time, services to support survivors are oftentimes interrupted. So that is something that we need to be taking into account and be providing information on as much as possible. Another key point to mention is that the impact of the crisis on the socioeconomic context, on the health aspects as well, is different for women and men, is different for other vulnerable groups as well. And we need to take that into account. For example, some women may not be in a position to make a decision about seeking healthcare for themselves or for their family as well. We can see some households that were already living in extreme poverty conditions seeing their living conditions worsen because of job loss or the economic consequences of the crisis. And we've seen reports, for example, of more cases of child marriage because they are facing a situation where they can't necessarily provide for their family. And so for us at Farm Radio, we really want to make sure that those concerns are reflected and are shaping the information that we provide the broadcasters. Yes, it's very much about how to stay safe and how to provide the right information, but it's also about understanding that gender equality issues are not something on the side that we can address later on. It's very much, as front and center in this crisis. We have a team of gender equality focal points in each of the country that we work in, and they are mobilized and ready to support the team as much as possible, providing information, linking with gender experts, and provide orientation to the people that we work with.
Mm-hmm. Caroline, thanks so much for your thoughts on this.
My pleasure.
I'd like to turn now to Pascal Mweruka. Pascal is Farm Radio's Radio Craft Team Lead for Anglophone Africa. He's normally based in Uganda, but Pascal is joining us from Nigeria today. In his day-to-day job, Pascal supports stations in setting up interactive and participatory radio programs. He's also a trained journalist with experience working in radio as a reporter, a program host, a news editor, and a programs manager. Welcome, Pascal.
Thank you, Nora. Good evening, everyone. My name is Pascal, as mentioned, and I'm glad that the music that was playing before was recorded in Uganda, and it was calling on people to do sanitization, to hand wash, and as well as also calling everyone to be in charge, to take a lead, to be a patriot. So that was the message in that music. And funny enough, it is done by one of the member of parliament in the Ugandan parliament. And that was part of what he could do to make his voice heard to many. So,
oh, I understand we have a clip from Radio Simba.
Yes, yeah, we have a clip from Radio Simba. This is part of what our partner radio stations are doing to make sure that information is disseminated quick and in the most easiest way. So this clip was done by one of the broadcasters in the morning show, which is one of the popular morning shows in the central business of Uganda. He was calling for people to wash hands, but just not washing, but washing them fully and taking time using soap and water. Yeah, that's
the bad news is that everyone is a potential victim. But the good news is that everyone is a potential solution.
Abawuliza baseddume ku Simba mwenna mbabuuzaako amannya nze Profesa Kidomole njagala kubategeeza nti obulwadde bwa coronavirus oba COVID-19 gye buli bungi kyokka ekisinga obukulu nti weewalika ate ng'okuweewala kyangu nnyo kusinga okubujjanjaba nga bumaze okukwata. Tuweewala nga tunaaba mu ngalo buli kadde ne sabbuuni kyokka ne tuzinaaba ne zitukula. Buli omu afeeyo okulaba ng'alwanyisa obulwadde buno obutamukwata. Weekuume beera awaka tulwanyise coronavirus.
Coronavirus is sweeping over mankind.
Everybody must be alert.
That's great. So, Pascal, what are you hearing from Farm Radio broadcast partners about their needs and their welfare?
Pardon me?
What are you hearing from Farm Radio broadcast partners about their needs and about how they're doing?
Oh, yeah, it's most of these issues have been mentioned by Emmanuel and Jeff. They are not far different from what they have said, but to be particular, most broadcasters lack the PPEs. That is, most of them don't have them. Okay. It's funny when everyone is protecting him or herself, including government officials, including everyone, but broadcasters go not secured. So this is one of the things that is most disturbing, and some cannot afford because the pay is very little. They cannot afford buying such protective gears to protect themselves. And some broadcasters have no access right now to their different radio stations because public transport was cut. Most of them used to use public transports to access their working stations. They cannot do that. Actually, I think 2 cases so far have been reported, one in Uganda and I think another one in Tanzania. What broadcasters have done is to put some resources and buy some motorcycles or hire motorcycles, because each motorcycle is now allowed to be used by one person. And remember, most of them are just learners. So 2 so far have got accidents, they are dead. So they are trying to stay at work by all means, but they are ending up dying, you know. And most of them were laid off. Some, they are not working right now because their radio stations cannot afford supporting them at work during this time. You remember, you can recall what Emmanuel said, that advertisers will not come, business was put on a standstill. So even radio stations cannot afford raising salaries and wages to broadcasters when business is not normal as it used to be. So some are laid off completely, others are put on suspension until further notice. Others are cut, like when you used to come for work for 5 days, maybe they tell you to appear for 2 days. So this is the situation in most of the broadcasters across where we work from, where we are working from. Yeah, so that is some of the things. Actually, one other sad story was some of these broadcasters were told to stay or sleep at work. So sleep at work when there is no sleeping facilities. So that means you're going to sleep on the desk, because it was a directive one time by the president for everyone to stay at work at a certain time. And remember, sometimes doing broadcasting is a 24/7 kind of work. So some of these colleagues used to stay at work on desk. You take a nap on your desk, tomorrow morning you go away. One of the female broadcaster had to quarantine herself because she could not go back to her family because she used to do these errands during day and she wasn't sure of the people she's meeting. So what she did was to secure a room somewhere and then decided to leave, not to go back to her family. So sometimes these are some of the challenges that our broadcasters are doing to make ends meet. Yeah, so these and more of such stories are happening.
So what are some examples of the work that you've seen broadcasters doing right now? Are there ones that particularly stand out for you as being very helpful?
Come again.
I'm just wondering if there are examples of the work that you've seen broadcasters do that have really impressed you about COVID-19?
Yeah, some have done some good work. Some broadcasters are doing really good work. For example, the clip you've heard, this is an initiative by our broadcasting partners, everyone to come up and create something that can be pushed to the audience immediately, and they get information and do as required. Apart from that, many are doing jingles. They are doing radio jingles. Others are doing radio sport messages. You know, most of the broadcasters across the different countries have huge followings. So whenever people listen to them say, their voice counts. So most of them are doing such sport messages, jingles. Some are even doing news pieces. So each, after 30 minutes, you will get a news bite done in form of giving you tips, in form of demystifying the myth, in form of telling you how to be alive in such a pandemic, others encouraging farmers to keep on farming but taking precautions. So there are different formats our different broadcasters are doing, or we encourage them to do, in order to keep out messages in different formats. Yep.
Are there certain types of stories that you think are being underreported right now, or that would need some more support to continue being covered?
Yeah, my colleague Caroline has mentioned about how different females are mostly at risk. There is a story I followed in Uganda, some 3 cases for women who died. They couldn't access healthy facilities because there is no public transport. For you to get movement, you need to have permission from what we call resident district commissioners. And these ladies were expecting. So they couldn't make it to health facilities because they had no movement permits. 2, there was no public transport. 3, even they couldn't expect such a thing to happen. So 3 people died, and it is unfortunate that people did not consider that much pain or such stories will come to pass by minus anyone noticing, yet they happen. And so I think we need to make sure that our broadcasting partners take keen interests in such what might be regarded as minute things to be brought out for people who make policies to have a second thought. It was disheartening. I saw a photo when a lady was on a motorcycle and she was carrying a dead child because she couldn't access this service straight to the hospital because of a lockdown. This lady was carrying her dead child, and she was again going to hospital, but the child was dead. So we need, these are seen just on social media. Maybe they will never get access to radio or TV or any other thing because everyone is looking at the pandemic, the causes, the preventions, how many numbers, but there are some things that are going behind as a result of that our broadcasters need to give a look and make them known. Yeah. And in Nigeria, it is also certain that some of the leaders here, as I was watching news, listening to radio, some have even started to close out broadcasters to covering out some news because they have their differences in terms of maybe political affiliations. So they use this pandemic to say, no, because of social distancing, we are not allowing more than 10 people. So we'll only take 7. But the criteria for selecting the 7 is not clear. And so people are complaining. So a lot of things are going, but we are as broadcasters, we are trying to let them know how best these things can be articulated, can be isolated, can be amplified, so that we live in a way when everyone understands how we are supposed to live.
Yeah.
Yep.
Yeah. These are very important thoughts, Pascal. Thank you so much. I know that there are a lot of questions. I've been watching lots of questions coming in on chat, so I'm going to pass things over to Tara so that we can get some of the audience responses. Tara?
Thanks so much, Nora, for all of your work and leading this, and thanks to all of our participants for talking today. So we've got some really great questions from the audience. And so I'm just actually going to start actually from the most recent one, but don't worry if you put in a question before, I'll try and get my best to get to you. But a question from Heather to our broadcasters. So for Emmanuel and Jefferson, from Heather Hudson. So what sources are you as radio stations using to get reliable information about the virus?
Yeah, I think in terms of, because these are more technical information when it comes to scientific information. So like for us in Liberia, you have what we call the National Public Health Institute. Like I mentioned earlier, it was established as a result of the Ebola outbreak in 2015. So that is the specialized agency of government responsible for pandemic control in Liberia. And you also have the Ministry of Health and Social Welfare. You have the Center for Disease Control, which is supporting the government of Liberia, the US Center for Disease Control, and then the World Health Organization. So these are both national and global health bodies that are responsible to provide information about the pandemic. So these are places in terms of sources that information are approved, or approved information from these entities are the one, especially when it comes to creating awareness for prevention and other activities. These are places that we first look out to for information to share with the greater population, because these are certified information, more scientific, well established, well researched information. Because as we now consider, there are too much fake news. There are a lot of misinformation, disinformation. So how do you have a balance in not being tempted to give out the wrong information and then leaving out the rightful sources in terms of making your attribution to what you do? So we try to ensure that broadcasters, they cross-check, because now on the internet, you have a lot of information on the internet. So you cannot just grab bundle of information from the internet and then produce it into radio piece or take it for consumption for your audience. So what you have to do, you have to cross-check your information. So if the information is claiming to be from WHO, have you visited WHO website? And then maybe whether these information that someone is sharing with you, maybe through WhatsApp or Messenger on the person, maybe personal Facebook page, try to verify. I always try to tell the broadcasters that you trust, but it's good to verify, because just getting any information and dumping it to your audience for consumption, there are a lot of risks associated, especially with this virus outbreak. There are a lot of misinformation, a lot of fake news surrounding it. Some will say, okay, this a virus made from China. It's a Chinese-made virus. So, I mean, it was imported. Ebola was made from chimpanzee and then transferred to human. So there are a lot of information around this, but then you have to be very thorough as to what sort of information you give out that will not spark a problem or that will not mislead those that you are communicating. Instead of saving life, you'll be harming life. Depending the type of information you broadcast or you disseminate to your listeners. So we always try to guard against that by providing verified, well-researched, balanced, and then credible information from credible institutions and sources that are associated with, virus control and prevention.
Thanks, Jefferson. So another question for broadcasters, and perhaps I'll address this one to Emmanuel. So how are you and your team looking at how COVID is affecting people in rural areas and affecting agriculture in particular? Are you addressing that in your programming, and how so? And so this question comes from Jean Christie, sorry.
I don't know whether I have opportunity to just mention a word with the first question.
Absolutely, go ahead.
I recall when we recorded the first case of the virus in my region, I think the broadcaster just said, Eastern region there is COVID in Eastern region, so we should be careful. That was all what the caster said. And I later went to a health facility and the authority called and said, you are from a radio station. Why didn't you give clarity when you said there was a case or there is a case in the Eastern region? Because when we said, or when that broadcast came, which didn't give too much information or too much details, people decided not to visit their facility because they were scared. They thought any hospital or that hospital or any other medical facility has actually seen or taken care of a COVID person. Therefore, they didn't want to go to those facilities. So attendance at all these health facilities have dropped because of the reportage. So the way we report is very key. How we report it is also very important. The fake news you mentioned is very key, so we need to be very careful. Our looking at the WHO sites, we're looking at the government information ministry sites and their Facebook. We're looking at the Ministry of Health and that of Ghana Health Service. When we're getting information from there, we're more certain we're giving accurate information. I have said this, and I'm actually doing a project with another organization where we are getting schools to be doing some farming projects. Next week, we will be visiting those schools to find out what they've been doing with their school farms. Yes, schools have been shut down, but teachers are home and they have actually taken opportunity to still do some farming. And I've said and written a lot about this thing that agriculture could not stop even at this critical moment. If agriculture should stop, what it means is that COVID might not be killing like how hunger is going to kill us. So we'll still stay focused and still talk about agriculture issues. I was happy, was it somewhere last week, our agriculture minister was made to address the country and give us the state of our food security around this time. Whether prices of food items are going up or not, I don't want to go into the nitty-gritties, but what I want to say is that we're still focused and not neglecting agricultural activities. In my area, for example, we are battling with mining and agriculture. So we had an issue. So I needed to invest more to bring out what was happening. When there was a lockdown, government said construction and mining should also continue with essential services. We had a bit of a problem with why government would allow mining activities to go on during this period. So within this period, my network has we've actually done a series of stories with videos showing how the mining and illegal mining activities have polluted a lot of the water bodies within the farming communities, actually polluting their water to the level where they can drink it. And let's not forget, they do not have potable water or taps flowing. So they rely on these rivers and streams. They are heavily polluted. Therefore, they also have challenge doing the irrigation. So they can't irrigate their farms and their crops because their water bodies have been actually highly and very much polluted. When you, even within the same area, in this farming area, those areas where they have pipe-borne water, what chance of where Ghana Water Company has shut down their treatment plants because of the heavy pollution, meaning those rural communities won't get water. So I have to do a series of stories because stability of the water has gone up. So we've not relaxed in our reportage in the Greek, because if we do, we will go hungry.
Thank you. That's a really good point. I think we're running a little bit behind, so I'm actually going to ask one more question, and then we'll do a bit of a wrap up. But if the other people on the call are willing to stay once we've finished, we might be able to get to some more questions after that. But first, I'm just going to ask this one question, and then I'll pass it over to Kevin to wrap up the event. So again, this is a question for Emmanuel and Jefferson. Maybe Emmanuel, I'll ask you, and then Jefferson, or both of you. What are the questions that you're hearing from your listening audience? Like, what are they asking you when it comes to the scenario right now?
Yeah, so one of the questions is that the issue, like Emmanuel said, are you there?
Please continue. Okay? Yeah.
Okay, so one of the questions always coming out from listeners is the usage of the nose mask. I know, so because recently, during this extension of the state of emergency here in Liberia, the government added new measures, as part of the state of emergency, asking that everyone, whenever you are appearing in any public facility, you should always carry a nose mask. So there were not much education as to how the proper usage, how long it should be. So like most of the radio journalists that have been producing radio program, they've been getting feedback from the listeners as to, for example, if we are 15 in a house, should we all have the nose masks at the same time in the house? If we are going to bed, what should be done? And, so these are some of the questions, because there are not been much public education about the usage, and the maintenance of the nose mask. So a lot of people have been very curious because it has now been mandated that when you are in a public space, ensure that you have that with you. So people are very curious to know as to how, to maintain it. So that's one of the key issue, or one of the question areas that a lot of people have been concerned on the usage of the nose mask. And then talking about food security, especially for Liberia, but like 80% of our food intake or consumption, we have to import from Asian countries. That's part of the fertile soil. So like Emmanuel said, the post-COVID-19 maybe challenge will be food security, because the virus came just at the commencement of another farming cycle. And then people have to observe, for example, the social distancing. And in Africa, mostly we are engaged in what we call communal farming. So how do you congregate to farm when you have to distance yourself socially, physically? So that's a challenge. So as a result, a lot of people are not engaged in full-scale subsistence farming this season. And then what happens if countries that send in food supply to countries like us, those supplies are not forthcoming? So there have been a problem. So recently, government has been able to develop an emergency response mechanism as to how they can address the COVID-19 fight and also responding to national food security, because that would be the next maybe outstanding challenge for the country if we are opportune to maybe get rid of COVID-19, because at present we have our case low at 140 with just 16 deaths. So there are a lot of window of opportunity, but again, we should be bracing up for the aftermath of COVID-19. We'll be slipping into maybe a major food security situation.
Thanks. And Emmanuel, actually, I'll pose that first question that I asked to you as well. What questions are you hearing from your listeners in this current scenario right now?
Okay, so first of all, there are questions about why we are testing in only one region. I mean, in the eastern region, I can't be tested. They can only take my blood and take it to Accra to be tested, which takes a longer time, somewhere maybe a week or two before my test results will come. So the questions like, why don't we have testing done in most hospitals in the various regions. We have about 16 regions in Ghana. Only one region, which is the capital, is where we're testing. So wherever you show symptoms, it means we need to take your blood samples to Accra to go and test. So people ask those questions. The questions on mode of transmission is still not clear to people. People still want to find out whether it's an airborne disease or just what we are hearing. So people are still unclear about it and they still ask questions. People are asking questions on where to find PPEs, especially nose masks. And people are pushing and asking if government, or why is it that government is unable to subsidize for the things we need in here. Something like masks, the nose mask prices has gone up, hand sanitizers prices has gone up, Veronica buckets prices has gone up. So, I mean, some liquid soaps, there's also prices has gone up, or sometimes you don't find them at all. So there are people who will call and say, I am in this community, where can I get this? Where can I get something like this? So these are some of the questions I think I can recall as we speak.
Thank you so much for both of your answers. Really quite interesting, and we really want to thank you for joining us today, as well as Nora for answering the questions. I'm actually going to pass over to Kevin to wrap up for this evening. And for those of you who did ask questions, we want to find a way to respond to them as well, and likely we'll respond to them when we share this video. So I'm going to pass the mic over to Kevin to finish up this afternoon or evening or mid-afternoon, depending on where you are today.
Thank you, Tara. Fascinating discussions indeed, wonderful commentary. And I think these discussions remind us that in times of crisis, radio is something we all really need and and hopefully can count on. And it plays a crucial role in providing accurate and timely information to all of us. Wanted to remind you that, that we are fundraising to help keep these critical information services on the air during this difficult time. So the Emergency Support Fund that you heard a bit about in particular is something we're looking to build upon, to offer more support so we can ensure people are getting the timely information they require. If you're able to contribute, you can visit farmradio.org/COVID-19. Tara is going to share the link in the Zoom chat box for you. Every little bit helps. We know these are tough times economically, so it may not be possible, but if you're able to support, it'd be greatly appreciated. Thank you for joining us today, and thanks to everyone who asked questions. We really appreciate your interest in our work and the work of broadcasters across Africa. I'd like to make a special thank you to those of you who joined us from West Africa this evening, Pascal, Jefferson, Emmanuel. I'd also like to thank Carolyn and our staff that joined us today, and Tara for producing this so wonderfully. And a special thanks to Nora Young for hosting this event. As you maybe heard, the town hall is being recorded, and we'll be sharing the video on our social media channels and via email. So then it'd be wonderful if you would share it with your friends and colleagues, people that you think might be interested in this work. So thanks for that, and I'll close it here. Tara, I heard you say that we'll continue to address some of the questions, but let this be the official closing moment for those that need to leave us now. And thank you again for taking the time to be with us, and please stay in touch.